Hi, I'm Dr John McNamara from the Endodontic Group. Thank you for taking the time to watch this video and get some background information about your root canal treatment. Most patients find root canal treatment a little daunting to begin with, so communication is key. Before treatment takes place, your endodontist will meet with you and discuss your treatment and answer any questions you may have about the process. During this consultation, please feel free to raise any concerns or questions you may have. This video will cover some common questions, but nothing compares to a one-on-one conversation. Let's start with the basics. An endodontist is a dentist with a minimum of 2 years of postgraduate training in treating the diseased or damaged pulp of teeth, and they're registered as a specialist with the Dental Board of Australia. We limit our practice to root canal treatment and other procedures involving the pulp, diagnosing and relieving orofacial pain, treating traumatic injuries to the teeth, and managing orofacial infections. While some dentists choose to perform routine root canals in their practice, it's very common for dentists to refer their patients to a specialist in the field. And this ensures their patients receive expert treatment and the best possible outcome. This is particularly so for back teeth, which all tend to be difficult. At the Endodontic Group, we put the most advanced technology into the hands of highly trained specialists for the benefit of our patients. Our specialists are all chosen for their unique skill set and knowledge, developed over many years, collectively over 200 years of experience. Our state-of-the-art equipment includes operating microscopes, digital x-rays to minimise your exposure to radiation, cone beam CT facility which provides a 3D image to allow better imaging around the tooth structure for optimal diagnosis and treatment. We only operate with single-use instruments, and this significantly lowers the risk of complications during and following your procedure. Dental pulp is soft tissue inside the canal or channel that runs through the root of your tooth. It consists mainly of blood vessels and nerve fibres. Its main purpose is to regulate the development of the tooth during growth. A fully formed tooth gets its nutrition from the tissues surrounding the root, so a tooth can function without its pulp, and in most cases, a treated tooth can be kept permanently. After endodontic treatment, a tooth is pulpless, but it's not a dead tooth. The most common cause of pulp damage is deep tooth decay, which allows bacteria to reach the pulp. The pulp can then become inflamed or infected, and this can spread into the surrounding bone. This can create an abscess, which could be accompanied by pain or swelling, though not always. Other causes of pulp damage include traumatic blows to the teeth, leakage around old or loose fillings, excessive wear of teeth, and cracked teeth. First of all, local anaesthetics given to ensure you'll be comfortable. Throughout your treatment, your tooth will be isolated and protected with a sheet of rubber, which we call a rubber dam, to prevent debris from within the tooth entering the mouth and stop saliva and bacteria from the mouth entering the tooth during treatment. There are 4 stages of endodontic treatment. First, we need to gain access to the tooth to remove decay before we start treating the pulp. Next, we remove infected or damaged pulp from the root canal of the tooth through the small access hole. Then we clean, disinfect and shape the root canals so that they can be completely sealed. Finally, we seal the root canals with a filling material to prevent reinfection. And to complete treatment, you may require more than one appointment, depending on your case. In between visits, you'll be able to use your tooth for chewing, but you should be careful with it. Once endodontic treatment is complete, we'll be in contact with your dentist to give them a summary of your treatment, and you'll go back to your dentist for a filling or a crown. This should happen as soon as possible, since there's some risk of damage to the tooth from biting forces. Endodontic treatment is a comfortable procedure. We use local anaesthetic during treatment to ensure you'll feel little or no pain. Our first priority is patient care and comfort, so we do offer sedation and general anaesthetic options for our more anxious patients. Please feel free to call and speak to one of our experienced team members for more information about these alternatives, and certainly discuss it with your endodontist at your consultation. After the appointment, you may experience some discomfort due to inflammation surrounding the tooth. This may take a few days to settle down, and you may require some mild analgesics to reduce the discomfort. Severe pain or discomfort that lasts more than several days is not usual, and you should contact your endodontist if this occurs. Endodontic treatment can be quite a complex procedure and the cost will vary depending on the type of tooth and difficulty of the treatment. Whether your case is routine or more complicated, you'll benefit from the Endodontic Group's experience, expertise, techniques and technology. We're committed to delivering our patients the highest standard of treatment, and we're also committed to being upfront about the total cost of your treatment at your initial consultation. During your consultation, your endodontist will discuss all of the costs associated with your particular case, so there won't be any surprises. Prior to that, please call the Endodontic Group and one of our experienced team members will talk you through the typical costs of treatment. As a comparison, endodontic treatment is usually less expensive than an extraction and replacement with an artificial tooth, and there's really no substitute for your own tooth. It's far more efficient in chewing and biting than an artificial tooth. Evidence also suggests that when restored well, natural teeth will also usually last longer than artificial teeth. Before treatment, we need to obtain your medical history. You can complete this form on our website at a time that's convenient for you, or arrive about 10 minutes prior to your appointment to complete the form at the practice. If your dentist has given you a referral letter or x-rays, please bring these to your appointment. Also, if you're with a private health fund, please bring your membership card with you. If you have any specific questions for us before your appointment, please feel free to contact us. We're here to ensure you get the best outcome possible and to make the process as easy and as stress-free as we can.